Okay, I think everybody's all right. Everyone's muted, so make sure you unmute yourself if you are talking. We want to get together. Well, first of all, can you hear me? Steve, can you hear me?
Yes.
Okay, good. Thanks everybody for getting on the call. We had said we would get together in a couple of weeks, but we had some information that we want to share and also get your help in distributing information. So good news is we've been able to, the Charities Trust and the county and schools and everybody else working together have been able to provide logistical support and other resources to the healthcare providers to have clinics here in the county. There are clinics other than these that I'm going to show you here in the flyer, but these are the ones that are happening next week. I'm going to try to share this. Hold on one second. So hopefully you can see that. It's a little small, but next week on Wednesday, Thursday, and Friday, 3 days in a row, there'll be clinics, drive-through clinics at the high school in the back parking lot. The first one's MUSC's putting on, then Scotland, then McLeod. And not to read it to you, I'll send this to you after the meeting in a way that you can print out, and then also an image that you could share on your Facebook pages for your organizations. Also, we can print out color copies of these here and have them available for you if you want to swing by and pick some up to give out. It's super, super important that we have a turnout for these things. There are, pushing 700, 800, 900 doses here that can be administered. The MUSC one is, you don't have to be an MUSC patient. They do want you to pre-register, but they have potentially 400 or 500 doses. Scotland, a little bit less doses. You don't have to be a Scotland patient, but you do have to go through them and register. McLeod is primarily a second doses, but there could be a chance they have some more, and we won't go too deep into that publicly, but there may be some more opportunities there. And as that, Sully, I guess as that develops, we'll share that information with you all as well. So hopefully you can see this. There are phone numbers or links on here for people to register, and we will update this as we get more information on that. It's just open to 65 and older. You can see that down at the bottom. Parents who are home people who are home caregivers of chronically ill or special needs kids, those sort of things. And then still open for phase 1A, which are healthcare and first responders and that sort of thing. So that's still open as well. Steve, can you share with us the items, or Steve and Jane share with us the items that the resources we're providing for these folks?
Sure. What we've developed is we have 2 60-foot long tents that we'll put in place, along with internet traffic control for the events, as well as any ground support. We'll be providing 3 golf carts out there so we can have runners running vaccine back and forth for those that when they have to be reconstituted. Certain vaccines need to be reconstituted, others don't, apparently. So we'll provide all of that and any other logistical support. The only thing we really need from a medical provider is their staff and them to do the administrative documentation of the actual vaccinations, and distributing the cards to the patients when they're done. We're also providing the EMS staff to monitor the observation parking lot, so that for the 15-minute wait, make sure there's no reaction to the injection. We'll have staff with a EMS truck there at the same time, so should there need to be a transport, we can do that. And that's basically it, and we have a document that we can forward to any healthcare provider that lists all these items that we can provide. We provide generators, obviously power, tables and chairs, everything except the medical service that is needed, we will provide. The big key thing is for the medical staff to bring vaccinators, to have vaccinators, because DHEC, you would have thought, would have had this huge database of vaccinators that were already vetted. They've got a long list by name and email, and that's it. And none of them have been vetted. So you can understand what the huge hurdle that would be. So,
yeah, so for that, with MUSC needed some staff for vaccinators, so we were able to get 10 student nurses from Northeastern Tech with their instructor. So that's 11 from through Northeastern Tech. We have 8 Francis Marion student nurses with their instructor, so that's 9 from Francis Marion. We have 5 of the Marlboro County school system nurses, which are volunteering for us. And we'll also have 4 National Guard medics who can give injections. So and those are all on board for Wednesday to help out with the MUSC clinic, since they're bringing 500 doses. One other thing, Ron, I wanted to point out, I got an update this morning from the Scotland, on the Scotland phone numbers and the times that those phone numbers are going to be active, that I was hoping we can add this into the flyer.
Sure.
So on Monday through Thursday, that phone number is 7 a.m. to 6 p.m. On Friday, it's 8 a.m. to 4 p.m. And on Saturday, 8 a.m. to 1:30 p.m.
Same phone number?
Same phone number, 454-0245.
Okay.
And if there's any change or additional, I hope they can do more, but that if there's any additional to that, I'll let you know.
Okay. Sully Blair, do you have anything on the McLeod Clinic that we didn't mention, or Sully?
He was there. He's there.
Yeah, he's getting
there.
coming.
I had to find myself. You covered pretty much everything, Ron. Thank you. Just a quick update. I know there was a request issued for the possibility to utilize the property, the old hospital building. Unfortunately, that property will not be available. However, McLeod would like to offer financial assistance in our efforts in putting together these clinics moving forward. So we'll just need to work together to identify what that looks like and what we need, and they'll be willing to support that effort.
Okay, thanks. That's good.
If I can, this is Gregory McCord. We were talking yesterday, we being Ron, Steve, and myself, about the need for the parking lot to be resurfaced at the high school. Just want to kind of throw that out there when you start mentioning financial assistance. If there's any way that they could see fit to have a conversation about how we can do something of that nature, I'd be more than willing to talk.
And Sully, I'm sure, I guess you know this, of the tents, the Charities Trust is picking up the tents, the 2 long tents, 20 by 60.
Yes, ma'am.
McLeod thought they needed a 3rd tent, so they are picking up their own tent.
Okay.
They're covering the cost of their 3rd tent, since it wasn't something we were going to need until McLeod's event on Friday.
Right. And I guess just moving forward, I'm assuming we'll be putting together additional clinics. They would be willing to offer some additional financial support. We can get creative to see what we could put together for something more, I don't know if permanent's the right word, but something to use on a regular basis for these
That's
clinics.
good. Very good. Thank you.
Yes, ma'am.
Okay, and obviously this is we're making it up as we go. I mean, it's not really that simple. There's hours and hours of work and involved in it, but this is something we haven't done before. So you're right, Sully. We'll have more needs as we figure this out. So thank you for that. And thank everybody for their work. Jane, I've been amazed at Jane's ability to procure nurses. You know, it is amazing that they're able to get that many together. It's also, not to go off too long, but still frustrating at the bureaucracy involved in this. And I saw yesterday where the DHEC board decided not to make a decision on how to distribute the vaccines and to wait until March to make that decision. Of course, I think the undertone there, according to the media, is that the legislature or the General Assembly is going to make that decision for them, and I applaud that. It's just that it's unfortunate it's come to that. So, you know, it reinforces the need for us as a group, as I said in the email to you all, to stick together and to continue to push, because if we don't, then you're not going to see much. We, in that same vein, you know, you can't get an official answer from DHEC on how many folks in this county have been vaccinated. I was able to get an unofficial answer of about 750. Now, on the back of an envelope, we had all sort of figured out that we put out maybe 900 or something in there, right, Steve, in the county.
That's correct. Yeah.
So that tells you that, and then a lot of folks in this county went outside the county. So that number tells you that a whole lot of people have come into the county and used these doses that are being provided. And of course, the goal is to get the people, everybody vaccinated, you know, not just here, but it is a little frustrating. But if we're at about 750, that puts us at 2 and some odd %. The other, so at first I thought, well, you know, that's pretty good. But then the other information I was able to obtain unofficially is that some counties like Georgetown are 20% of their population has been inoculated already. So we're way behind. And so the fear here is that we put all this together next week, for example, and we don't use all the doses. I don't really think that'll happen, but I want to, and I know you all too, the ones that we've spoken, want to have to turn people away than to be running the phones and try to get people up there. So we're going to send out this flyer with a couple of tweaks, as I said, and send out the thing electronically so you can share it. It's also on the county Facebook page and the county emergency management Facebook page. But I think you all would agree that Facebook is becoming more and more difficult to navigate, and there's so much junk on there that you're not going to see that. So I took the liberty yesterday morning of registering a domain, a www domain. It's not active yet, but hopefully over the weekend we will have it active. Tried to pick something simple, so it is marlborocovid.com. And the intent of that is to just anything we get from the hospital systems, there are a number of flyers from the hospital systems, as well as, you know, this flyer, it's just to put that stuff up there. And then we can consider maybe doing a postcard mailing and that sort of thing, and see if we can get folks to go there that don't get on Facebook. I think, and I may be wrong about this, I think there are a lot of people that get on the internet and they have access, and even older folks, but I don't think there are people, there are a lot of people that are on Facebook, and then there are people on Facebook who you just don't see it because it's in the mess. So I did that. It wasn't that expensive. Now I just have to get it up on there.
Ron.
Yes, ma'am.
Ron, what are the chances of a postcard with this flyer going out in
Well,
time?
I think, Jane, the issue is that, say we generate that today or tomorrow and we put it in the mail.
May not get it in time.
I don't know if y'all deal with the post office much anymore, but they're not hitting on much. It's, you know, not the people that necessarily that work there. They're our friends and neighbors, but the system doesn't work very well. I think in the future we might could do that. And there is something to be said for if you do it and put it in the mailbox here locally, it still goes to Florence, but I think you might get something out of that. I was racking my brain on how to get the addresses, and I think probably if you were trying to target groups, you know, the voter registration list is a pretty good jab at that. They have age brackets and all that demographics on there. So that's sort of what I had, and then I would go around the room. Anyone have any updates or anything they want to offer?
Today, DHEC is doing a vaccination clinic down at the community center, and they have 204 first appointments scheduled today, and then they're doing the 196 they did 3 weeks ago. They're or 4 weeks ago. They're getting their second doses. So, and statewide right now, we're just over 600,000 people have been vaccinated at least once. And I think it's in the 80,000 mark for the second dose,
Okay,
fully vaccinated folks so far.
okay.
Hi.
Yes.
This is Pat Hannigan. Excuse my voice. I just want, I have sent out letters to the pastors, and I'm sending out because I have a list of about 60, and I sent out about 25 last night requesting that they announce that the churches, many of the churches are now open, you know, even if they're on the outside. So I just wanted you to be aware that I am sending those out to try to help make sure that people are aware of that they can get their vaccination and how to go about it.
Representative Hennigan, what did you, were you able to send this flyer out, or what do we?
What I did, I sent out, not the flyer you just showed. I sent out the one that came from MUSC that Joe McCall sent to me and asked me to get in the public's hand, and I did. But I will send this one out also, as soon as you get the numbers and everything on it, telephone numbers and all.
Okay.
Representative Hennigan, does that include the all of the Berea Association?
You know, some of the Berea Associations members are there. I just have a list of 60, and I'm not sure. I didn't even look to see exactly what the Berea Association, all of them are on there. I know that I have most of them because I know them by name, by their churches. But I can easily get that because I know who's in charge. I can get it from Gwendolyn Co.
Okay. Yeah, if you can help us by getting this out.
I will. I will get it out.
As
Also, I'm not sure if you know that $208 million have been allocated again now to help with the COVID-19. The governor is extremely proud of that. And I'm sure you already know that they're not going to be doing it they're going to do it this time based on population, not by how DHEC was doing it in the past, and a lot of it going to areas like Richland and Charleston areas.
that's good news. And I can call you independently. It's not something you might can help us with. Is they've released some grant funds, CDBG funds, but they are through Commerce, I believe, or somebody.
Yeah, they did.
And but they're not anticipating having the application process done for several months, and the money not to be allocated till the end of the summer. And
That's
I
what
wrote
bothers
back and
me.
said that's insane.
It is.
That is sort of typical of how things have operated. So
I know, and I talked to Merle Smith about that. I'm also going back and seeing the governor again about that too. And by the way, I don't have the virus. I've already had my 2 shots. I'm just hoarse today.
well, I hate your horse, and I hope you feel better. But being on Zoom, we're safe. Anybody who's got it, unless they can figure out how to do it through the computer.
No, I said in case you're worried about me.
Yeah, well, anybody who gets a sniffle, we all worry because you never know. And had a death in the community yesterday of someone, a city employee, I think Chad Powers.
Oh,
When yeah, Max, you're muted, but unmute.
I didn't know that.
Max, you're still muted.
But you know, one of the things I don't understand is how South Carolina can rank near the top in the nation, but yet we still haven't gotten as many as we should, the vaccination in people's arms. So I don't know what they're using to denote that.
Yeah, okay, I should be on.
Yeah, got you.
Okay, thank you, sir. I just want to say, tell you, thank you for all that you've done and everyone's done, and we'll continue to help any way we can. And yes, we had a death due to COVID yesterday, one of our employees. It looked like we peaked to about 8 or 10 employees back at the first of the month, and we're down now to only 2. So let's all pray that continues, and we'll assist you any way we can. Just let me know. Thank you.
I appreciate it, Max. And I'm so sorry about Mr. Powers. we lost the department head here as well. And it's just, you know, when you see things in numbers, they don't mean much. And then when you get a name attached, it brings it back home how dangerous it is. But yeah, Representative Hannigan, it is amazing with that number, that small number. And then, you know, at first, like I said, when I heard it, I thought, well, maybe that's okay. But then when they told me other counties, and the other counties are more affluent or more mobile and able to get around. So
You're right.
Ron,
yes.
Ron, I guess this might be more to Jane's liking. Scotland County, I know she's got contact with them. Did we ever get a number on them? Because it seems like every time I talk to someone, and I've talked to several people this week, and it's always the same. Yeah, I went to Scotland County and got mine. We bound to have a pretty big number over there at Scotland, and it should be a fairly easy thing since they're doing cards on everybody to get a firm number of how many Marlboro County residents went to Scotland County and got vaccinated, either the first or the second dose. But I can hardly go 3 or 4 times without every single person tells me I've gone to Scotland County.
Well, the number I quoted includes anybody with a Marlboro County address.
But Ron, I tell you what, when I went to Scotland and got mine, I was entered in the North Carolina database. And
Well,
the only contacts I've had have been from the North Carolina Health Department. So I understand that you say that we know that, but I'm not convinced that data is really being shared on a timely fashion from one state to another.
And
It'd be
you,
interesting to know what the other border counties have experienced, because you know a lot of people have been going out of state all along the border, and whether the border counties numbers are dramatically lower than the rest of the state, I think that'd be an easy way to look at it and see.
Yeah, and you know, the numbers I was able to get were unofficially from DHEC, and you know, considering all the other failings, and supposedly the numbers came off the VAMS system.
Yeah.
They also told me that only 7 states in the U.S. are using the VAMS system. So I didn't even think to look, you know, is North Carolina using the VAMS system? If it's not, then those numbers aren't jiving. You know, not to make the meeting last very long, but like DHEC has their own system, and then they're also using the VAMS system, and then, you know, it's just really disconnected. So yeah, you're right. I mean, it might be completely left out. Anyone else have anything? Steve, anything?
No, I don't have anything. I mean, that flyer speaks for it all. I will say this though, we are looking at, to speak to Sully's point, at a sort of a permanent situation somewhere at some point where it may have like the metal carports, the large metal carport type situation. Just so you know, I checked with those folks, and there's like a 4 to 6 month backlog right now because they can't get the material.
We can tell them off. It's good to tell them off.
Yeah.
But I still
So,
think.
but we are looking at that, so that's, you know, and because not only that, it can be used for so many other things should we ever need it. So that's the idea.
Right.
Mr. Mayor Brock, did you have your hand up? Or are you just waving?
I just wanted to wave at you. I could hear Pat talking while Steve was talking.
Yeah, we heard it too.
Hey, Ron, quick question. I don't know if this is realistic or we're able to do it, but is there any way to, because it's like you said, it's so critical that we get this information out and everybody's notified. Is there any way to do it via like a voice shot or through emergency management? I know it's difficult to control, I guess, the age groups, but at least everyone's being notified that these events are taking place, and then the households can disseminate it to those who are that it applies to, and then everybody in our community knows. I don't know if that's, Steve, maybe you could speak to that. I don't know if that's possible.
Oh yeah, we have the ability to issue a code red, you know, for whatever emergency we need, but, and this, you know, certainly falls into that category. We could, and it would hit every landline in the county, as well as anybody who's registered their cell phone within the county. So it would register all that, and it can do that in less than an hour.
And that may be a possibility then for us to consider.
Yeah.
That's a
and
good idea. Dr. McCord, do y'all have a voice, broadcast system to phone numbers?
We do, but it's only for families that have students enrolled in the school district.
Well, we were thinking offline yesterday, we know we have code red. NETC has something because my daughter gets calls. You might have some. There'd be some underlap and some overlap, but if we had a common message, then we could at least hit it and let people know that. Maybe we could have a separate call with the 4 or 5 agencies that have that blast ability. I think if I can get this website thing resolved here in the next day or so, then we could also point them in that direction to see that. So Sully,
Right.
I think it's a good idea. And
Ron, I don't mind if you give me a message that you want me to send out, I'll be more than happy to send it out.
well, and it may be a message we prepare, and then like you do yours, because there's some trust and relationships built up already with the different agency folks, and so we could all do it, but do it in the voice of the leader for that organization. So Sully, that's a good idea, and anything we can do to get it out and keep it out there, and to be sure that we speak with one voice, and don't have this piece of one and this piece of one and this and this and this. I think there's a lot of confusion in the community, and if we can come across with one source, then that's good. Okay. I don't have anything else. Like I said, I'll get you this flyer today, and it has all 3 on it as well. And we will update it weekly as we need to. Anybody else have anything? Thank you all for getting on the call on a Friday. Hope you have a good weekend. Those of you getting second shots today, hope you don't have a bad reaction. But I read that if you do, that means it's working. So, and Representative Hennigan, hope you feel better, and everyone else. Okay, we'll see you all next time.
Bobby Brock, thank you guys for that quick restoral the other morning.